If you or someone you love has been told that this disease is progressive and irreversible, do not believe it. They are absolutely incorrect. And reversing type 2 diabetes is possible, but it starts with changing how we think. We're treating the wrong disease. Why diabetes is more than high blood sugar. So welcome back to the Obesity Project. My name is Dr. Mark Shankman, and today, episode 35, why we're treating the wrong disease. So I want to share something I see far too often. A patient comes to me, type 2 diabetic. Their A1C looks great. They're on insulin and maybe a few other medications, but they've gained weight, they're insulin resistant, and they feel worse every single year, year after year. And yet their doctor says they're, quote, under control. And really, here's the truth. We've been treating type 2 diabetes backwards for years. It's not just about high blood sugar, it's about chronically high insulin. So most doctors wait until a patient's blood sugar is elevated to diagnose type 2 diabetes. But by the time your glucose is high, insulin has been elevated for years, if not decades. So Dr. Joseph Kraft, a pathologist who performed over 14,000 insulin assays, found something absolutely groundbreaking. Up to 75% of people with normal blood glucose had abnormal insulin responses, meaning they were already diabetic at the cellular level. And this is called hyperinsulinemia, or elevated insulin, and it can exist long before a diabetes diagnosis. And there was a study by Kraft in the journal Diabetes Epidemic and You in 2008 that showed that large-scale insulin testing showed insulin resistance decades before glucose elevation. So why don't we test insulin more often? And that's simply because it's not routine, not emphasized in med school, and quite frankly, it doesn't lead to prescriptions. So most of the medical world is focused on controlling glucose, not insulin. So let's break this down. So many patients take a drug in a classification called sulfonyl, now I'm messing it up, sulfonylureas, such as glipizide, which force the pancreas to make more insulin. And these drugs lower blood sugar, but at the cost of higher insulin, which worsens insulin resistance. So we're treating the medical problem completely ass backwards. And exogenous insulin, which is given from an external source, is often prescribed when oral drugs fail. And while they do lower, and it does lower blood sugar, it also promotes fat storage, increases weight, and drives insulin resistance even further. So let's look at one of the paramount studies back in 2010 called the Accord trial, where patients were treated aggressively to lower their A1C, and they actually had higher mortality in some cases. And what they were doing is they were using insulin and the sulfonylureas, the group of drugs that raise insulin, to normalize blood sugar. But those people were dying faster. And this is very common. We fix the number, but not the disease. We're not getting down to the root cause of the problem. We're only treating the symptoms. So insulin is absolutely the problem. And so here's the shift that we need to make. Type 2 diabetes is not a disease of high blood sugar. It is a disease of too much insulin for far too long. It goes on for years and years and years and is never picked up. So if high insulin causes it, the goal should be to what? Reduce insulin. And we know how to do this. It's very simple, but unfortunately, it doesn't make pharmaceutical companies money, and it's not putting money into people's bank accounts. So here's how we reduce insulin, very simply. Low carb or ketogenic diets, time restricted eating or intermittent fasting, exercise and sleep optimization. It's really that simple. It really is that simple. And type 2 diabetes, other than what the medical profession will tell you is a chronically progressive disorder, is absolutely a reversible situation. And we can do it in a very cost-effective way, right? So there was a study called the Virtua Health Trial in 2017 through 2021. It tracked hundreds of type 2 diabetics on a ketogenic diet. And here's the findings. Absolutely mind-blowing. 94% had reduced or eliminated high insulin levels, and 60% completely reversed their diabetes with an average weight loss of about 30 pounds. And Dr. Sarah Hallberg states we don't manage type 2 diabetes, we can reverse it. This is a reversible disorder. And that's what happens when we treat the cause and not the symptom. The medical profession, as a general rule, is treating the symptoms, which is blood sugar, and not treating the root cause, which is the hyperinsulinemia or elevated insulin levels. So let's take a real case example. Let me tell you about Michael. Michael's a 52-year-old type 2 diabetic referred to me as a surgical patient, as an oral surgery patient. He was on metformin, which is a drug that affects insulin. He's on Lantus, which is long-acting insulin, and occasionally needs some rapid insulin after meals. His A1C was 6.8, technically controlled, but he was continuing to gain weight. He was exhausted and terrified of complications. So we sat down and we talked, and he decided to try low carb, cut out seed oils, and started 16/8 intermittent fasting. 4 months later, he was off insulin completely, down 28 pounds. His fasting insulin was normalized, and his blood pressure dropped, and his meds for blood pressure were cut in half. Michael didn't just manage his diabetes, he reversed it. And how did he do that? He did it by lowering insulin. So let me be blunt. If you're a type 2 diabetic and no one has talked to you about insulin, not just glucose, you are being underserved. The medications we use are simply band-aids. They mask or cover the problem. They are not treating the root cause. And yes, they do lower the number. They lower that blood sugar number, but they let the fire keep burning. It's sitting and smoldering for years and years and years until it rages into a giant forest fire. So we're treating the wrong disease. We need to focus on insulin. We need to lower it through diet, through what we eat, fasting, and lifestyle. And then your body will begin to heal. And so this will affect so many chronic diseases in the long term. When we look at the dietary guidelines that came out in the late 70s into the early 80s, there was about a 10-year lag. But what we started to see is a tremendous increase in obesity, a tremendous increase in insulin resistance, and then a tremendous increase in type 2 diabetes. The 10-year delay I mentioned is actually for type 2 diabetes. The obesity started pretty quickly thereafter, probably within a few years. So we've got to focus on the root problem, the hyperinsulinemia, the diet, the lifestyle, and then we can reverse not only type 2 diabetes, but many of the chronic disorders that the world is suffering from right now. So if you or someone you love has been told that this disease is progressive and irreversible, do not believe it. They are absolutely incorrect. And reversing type 2 diabetes is possible, but it starts with changing how we think. So thank you so much, everybody. I appreciate it. This is one that's kind of burning a hole in my gut. Discussing type 2 diabetes is going to continue to be one of the most pressing things that I feel like I need to go into. How the medical profession is bought by big pharma, how our dietary guidelines are influenced by major food corporations. This is a money game. It's all about where the money goes, and unfortunately, at the expense of all of you out there, and including myself as well. So let's start by educating people. Let's start by letting them know that we don't have to follow these poor recommendations that were not based in science, not evidence-based science, but by epidemiologic studies that showed correlation, but no cause and effect. Um, it's just been a travesty of justice how the government has made these recommendations without any scientific background or basis for these recommendations. And as a result, we all become more obese. We all suffered type 2 diabetes and insulin resistance, and we're all suffering from these major chronic illnesses like heart disease, liver disease, cancer, mental health issues, Alzheimer's. All of these chronic diseases can be prevented if we focus in on insulin. That is the major root cause. That's what we have to correct. And share this video with anyone that that doesn't understand type 2 diabetes, or you see type 2 diabetics eating sugary products and desserts and candies. We need to correct what they are thinking, and then we can correct how they're treated. So thank you so much for watching. I appreciate you, and I'll see you in the next video. Take care.